Third case, an unhappy patient with a multifocal lens. This was a young 54 woman, a lawyer. She was looking for spectacle independence but had no cataract at all. And moreover, she was slightly myopic, so she was used to a perfect vision for near. When I looked at the cornea topographies, you see that there's some steepening and some asymmetry, but this was out of the pupil side, of the pupil area. So I warned the patient, but said, okay, this should not be a problem because inside the pupil area, the bow tie is regular, so astigmatism is regular. We can go on with the trifocal lens toric in the bag. So again, here you see that the steepening is out of the pupil, and I was not afraid of a night driving problem because this woman was not driving the car, so not a big problem. Here again, you take a look at the pre-op cataract screening, and you see that total higher order aberration at 4 millimeter was okay, 0.09, so much lower than in the previous patient. And here you see the calculations made by the Pentacam wave with the Haggis and Barrett formula, which take into account the ACD and are among my preferred choices. I selected the 17.5 diopters. I just want you to focus on the right eye because the left eye did not have any trouble. And one day after surgery, visual acuity was just 0.4, and this was the first eye, and the patient was very unhappy, and I was very scared about this because I had a lawyer in my face. There was no corneal edema, no inflammation, and at the slit lamp, it was impossible to understand what was going on. I was not able to understand why such a low visual acuity after surgery. Let's go to the Pentacam wave, and you see that the internal E was almost perfect. So no problem from the IOL, while the corneal was not perfect. And if you take a look at the map, you can see that the corneal steepening had moved from outside to inside the pupil area. And you can easily see here from the comparative, the differential map. Here you see the pre-op with the steepening outside, and the one-day map and steepening moved inside the pupil area. And you see here also in the differential map. And this was sufficient to decrease the visual quality to have just a 0.4 visual corrected. She was plain also. This was the maximum. Little by little she improved, and because the steepening came back to the original position, probably this was a mild subclinical edema, and so the curvature came back to the original one, and after 3 months, the patient was happy, and the cornea topography was the same than preoperative, and the case was resolved without anything else. And here you see that now patient was okay after one surgery, and the cornea was good. Everything was good after 1 month, after 3 months. If you take a look at the aberration, and you can see that 1 day after surgery, higher order aberration were 0.258, and 3 months they decreased to just 1.15.